Before the pandemic, New York was making some good progress on reducing the number of overdose deaths each year. And that's important because before that, the state's overdose crisis had been getting worse, fueled mostly by opioids and heroin. And then things changed again when COVID hit. Overdose deaths have only gone up since then. So new strategies to help people struggling with substance use are now in the spotlight. Alexis Young reports.
New York's opioid crisis has gotten worse over the past few years. The state saw a 50% spike in the number of deaths from opioids in 2020, according to the U.S. Centers for Disease Control. And last year, the number was even higher, with about 4,500 deaths statewide. But before 2020, the numbers were actually going down. So the conversation on how to address the crisis has now changed with the focus on harm reduction. That's when the goal is to keep people alive while they battle an addiction. Dr. Chinazo Cunningham is the commissioner of the State Office of Addiction and Substance Abuse Services.
Harm reduction is not new. Harm reduction is really, an approach and a set of principles and practical strategies that really focus on reducing harms associated with substance use. And harm reduction was really born out of HIV, but I think in terms of really focusing on drug use, there's been more recently a willingness to embrace harm reduction.
And harm reduction comes in a lot of different forms. We find one here at Project SafePoint, run by Catholic Charities Care Coordination Services in the Capital Region. It's a nonprofit that provides harm reduction services like a clean syringe exchange for people who use. They also offer training for what to do when an overdose happens, like using naloxone or Narcan to save someone's life. Candace Ellis, the executive director, said that's to meet people where they are in their recovery, instead of a more traditional model.
I think some people are familiar with a more medical model. So you go in, someone assesses you, gives you a diagnosis potentially, and says, here is your treatment plan. And this is what you need to do to manage that particular condition or whatever that might look like. Here it's really, someone might come in, say, for looking for safer injection supplies or to get some Narcan. And we'll just have a conversation. Is this all you need? Is there anything else that we can help you with today?
Ellis and others at Project SafePoint want to change the public's view of addiction and substance use. That way, they say people will be more willing to ask for help when they need it. That could also make it easier, they say, to connect people with services like Project SafePoint's LEAD program. That program partners with law enforcement, so when they come across someone who's struggling with substance use, they can refer them to community resources like Project SafePoint. Tara Madrid is a LEAD or LEAD case manager.
It stands for Law Enforcement Assisted Diversion. So oftentimes we are getting referrals from APD, Albany Police Department, and what they're doing is at the point of contact of a possible crime being committed, they send them our way and say, hey, this person seems like they might need some services in the community. And so when they come to us, what we do is we go over a brief intake with them, generally get an idea of where are you at in your life and your needs and what is it that you want to work on right now. So then we set up a service plan with them.
And that plan will be different for everyone depending on their situation. For some people, it can really help to work with someone who's been through it. That's where Heather Charbonneau comes in. She's a state-certified recovery peer advocate, which is someone who struggled with substance use in the past and can share how they got through it.
Being a peer, you've been through it. You also know the struggles and the barriers within the system and navigating it and the lack of support. And one thing I can say about harm reduction, risk reduction, recovery, or just a human, period, connection. Connection is always the start of a relationship, and most times I can't tell you how many people were just grateful that I was able to talk to them and let them be them without saying, you need to do this, you need to do that.
It's all a part of Project SafePoint's big message, that people struggling with addiction need help, not punishment. But it's also about recognizing when someone needs more help than Project SafePoint can give them. Groups like Project SafePoint can sometimes serve as a stepping stone. For some, it's about getting into a treatment program, either through a doctor or a licensed facility. For Jake, who didn't give his last name, that was Dynamite Youth Center, which has facilities in Brooklyn and the Hudson Valley.
I was in a school shooting, 2018. Heroin threw my life away. I had the chance of playing baseball at a very high level. I threw it away. I got arrested. I was facing prison time at 16 years old. And after I got out, heroin helped me cope with everything.
Jake was speaking at a meeting of the state's Opioid Settlement Fund Advisory Board. That board was set up this year by state law, after opioid companies agreed to pay the state more than $1 billion. That was to settle a lawsuit over their role in the opioid crisis. And now, the advisory board will decide where that money goes. That's happening over the next few years. State Senator Gustavo Rivera is a Democrat who chairs the Health Committee, and he also sponsored the bill that created the advisory board.
As we have been getting, getting some of these companies to pony up as we reach settlements, then we just want to make sure that that money goes towards actually fixing the harm and repairing the harm that has been caused by overdoses and by the deaths or by the harm that has been caused, just period, by this opioid crisis. With the involvement of the board, you saw the board, right? The involvement of the board, like the board has to vote on it, to make recommendations on how that money is going to be used. So it is around recovery, harm reduction, and treatment. And we want to make sure that that is what the money is used for.
The board started its work in June and has held regular meetings since then. And while that money is expected to make a real difference in curbing the opioid crisis, other strategies for harm reduction are now emerging in New York City as well.
Senate Bill S-603, or Assembly Bill A-224, advocates for safe consumption services at sites like On Point NYC. Both their East Harlem and Washington Heights locations offers folks who use substances a medically safe place to consume their dose and receive holistic health care services that don't demonize their clients, but keeps them alive.
So we don't provide any drugs, we just provide clean materials for people to consume drugs with. Whatever they deem as one dose, we allow them to do. So if that's a time in the smoking room and then an injection time, we allow that to happen, right? We just want to make sure everybody does their dose and then gets going.
Race Samuelson is the overdose prevention specialist or responsible person in charge at On Point's East Harlem location, which opened last year, along with On Point's other facility in Washington Heights. They were actually the first 2 overdose prevention centers to open in the country. The primary draw here is that it's a place for people to use drugs with medical help on standby. That's Samuelson, who's ready with an overdose reversal drug in case it's needed. That way, users can stay alive as they continue their battle with addiction.
We can slowly bring the Narcan up, 0.4 milligrams at a time, to eventually bring somebody out of overdose. We don't need to bring them out as quick as we can. And so that's really a unique thing to this program, a unique thing about overdose prevention centers. We're able to respond so quickly that an overdose in here isn't what an overdose out in the street might look like. It's a completely different being.
Having a combination of medical equipment on hand and a supply of Narcan has helped On Point save countless lives, according to officials there. And they also offer other harm reduction services as well.
So we have fentanyl test strips on site if people want to test their drugs for fentanyl. The reality is every bag of heroin we've tested since 2017 has fentanyl. So it's really, our fentanyl test strips are not super helpful for our people using heroin, using opiates. What they're really great for is our people who aren't using opiates, who are using stimulants, uppers, cocaine, methamphetamine, crack, right?
On Point facilities include places for people to shower, do their laundry, get food, and see a health professional. Susan Spratt manages clinical services there.
We do a lot of what we call bridge care. So it's primary care stuff, but for our folks who've had negative experiences in traditional healthcare settings, we're just sort of trying to bridge care so that we can then connect them to primary care clinics that are going to treat them well.
They even have guided meditation and auricular acupuncture, which is
acupuncture that's done in the ears for detox therapy. When people are detoxing off of substances, it specifically was developed to support people getting off of opiates and managing their withdrawal symptoms. But it also helps with stress relief and anxiety. And so it's something that you don't have to be a drug user to benefit from.
Kyla, who didn't give her last name, is a holistic health specialist with OnPoint. It's an important part of what they do there, she says, because drug use and trauma are often connected. So treating both can have a lasting effect.
Right? We are dealing with a lot of communities that have severe mass incarceration trauma, have been victimized by the war on drugs and by the very racist and classist war on drugs, right? So we see our people and we know that we are worthy of more. And so this is a way of healing so that we actually have hope.
Like Project SafePoint in the Capital Region, harm reduction strategies are key here at OnPoint, where the goal is to help people survive and find treatment should they want it. It's also where we find Will. He uses OnPoint to
make sure I get me clean supplies for when I go home, clean syringes, needles. I just use them for the basic necessities, but overall it's a wonderful program, a wonderful facility.
And Will's no stranger to treatment, but
I wasn't there willingly. I was court mandated, so it wasn't no enthusiasm to get sober. So it was like once I left the program, reservation was right there.
Not everyone supports facilities like OnPoint. Opponents see them as places where addiction is encouraged and where users are enabled. Will said he sees where they're coming from, but it's not like that.
I can see the double-edged sword of the conversation, but the community needs to understand if they have a safe consumption site, you don't have to come out your apartment and see if a user in the staircase showing up. You don't have to see users on the back of your building or in the doorways and stuff like that. This is a lot better. It takes the drugs off the streets, out the civilian's face.
OnPoint's 2 locations are still the only overdose prevention centers in the state. That could change if Assemblymember Linda Rosenthal's and Senate Health Chair Rivera's bill passes. It would allow overdose prevention centers to be set up around the state. So far, the bill hasn't had enough support to pass. In Harlem and the Capital Region, for New York Now, Alexis Young.